Important to me. I've been very fortunate because of my belief in exercising and working out and nourishing my body with supplementations. I was able to sustain a youthful body, but it has changed because of having children.
Anna was always self-conscious. She's always into her little cheerleader body.
Actually, I don't really need to lose that much weight. Imagine, I mean, my boobs got so big.
Anna has always complained about her body. The first time I saw Anna without any clothes, oh my gosh, I was speechless. I didn't know that the body could do that.
Look at this.
I know.
Look at this. That's a poor thing, huh?
The sacrifice you made.
My stomach and my breasts are my biggest insecurities. You know, I gained 60 pounds on my first child. You really stretch yourself out, and it didn't bounce back.
Was that what's going to happen to me?
Yeah, after you breastfeed 4 kids, I was at 36D.
Oh my gosh.
And with the regular bra on, with push-ups, I'm a 34B. So that's a lot of, stretched out skin. There's stretched out skin that I have to now tend to, and stretch marks as well. So it's taken its toll.
I guess you could say she sacrificed her body to have children, because I think it pretty much started even after her first one. So it wasn't like they were going to go away. It just kept getting worse.
After you breastfeed, you hope you don't get flat like this. I chose to have my breasts done. It's not about getting bigger. It's about lifting them up, putting them back where they're supposed to be, and filling them out because I have a lot of loose skin there. I've chosen also to have my tummy tucked because of the skin that has been stretched out by birthing 4 children.
Tell me, what brings you in today?
Boy, I'm ready to resume as much of my natural body as I can get.
Is that right?
Yeah.
Anna's a 42-year-old woman who's had 4 beautiful children. She doesn't like her saggy breasts, and she doesn't like the extra skin of her tummy. And she comes with very reasonable expectations. Okay, may I examine your breasts? Sure. What we like to do, Anna, is find out what the position of the nipple is compared to the fold. So I measure the distance from your sternal notch to your nipple, and it's 26. Now, how tall are you?
5'4".
Okay, excuse me. 4 is 24. So this breast is a few centimeters down. Is this breast a little bit lower? Your left breast? Yeah, it's a little bit lower. And that's not uncommon. Frequently we find that one breast is lower than the other. Can you stand up for me? I want to see your abdomen, right. Okay. When we do a tummy tuck, we remove this extra skin. I would suggest if we do a little liposuction here also at the same time, just to tighten up and thin your waistline. Does that sound reasonable?
Yeah. Now, tell me about the scarring and how that would, what is the tummy tuck and how much of these stretch marks will be removed? I know you can't.
Let's assume that you were having a bathing suit like your underwear here. We would confine our incisions down here and then come up so we could conceal them in a bathing suit. But we would want to lift up this skin and this skin and get rid of all of this tummy skin here. So the stretch marks from your belly button down will be gone. The stretch marks above your belly button will now live below your belly button.
That would be great.
Yeah.
It would make a whole big difference in a bathing suit, wouldn't it?
Tummy tucks or abdominoplasties are very common in all women, especially women who have had multiple pregnancies. You look at women who have had 4 children, their abdomens usually look worse than if they've had 2. But we see women who have had 1 and they have blown out abdomens. So it's not entirely dependent on how many pregnancies one has. A lot of it's genetics. You got to pick your parents well. Okay, so we're going to be lifting your breasts by doing this mastopexy with the laser bra. I find that some people benefit from taking a look at a drawing that I do. Would you like to see what we're talking about here? The general breast shape that we want to achieve is something in this general area. Presently, you're kind of like this. And so what we do is we create this laser bra in here, and we rock everything up, and now the new bra lives right here. The laser bra is made with the woman's own tissue, And what we do is treat the extra skin with the laser. We create a custom bra that we then place inside and underneath the flaps of the woman when we're doing the lift. The bra is actually secured to her chest, holding the breast upright, and it's permanent, it stays there. We're going to be lifting the breasts and enlarging them with silicone gel breast implants. If we look at your breast straight on, when we're done, the bra is on the inside here, and it's attached to the chest wall. The implant, then, is right underneath here.
Is this the right thing I should be doing?
I think this is a perfect thing for you to be doing. You're a great candidate for this. You have minimal amounts of breast sagginess and abdominal fullness, but enough to justify surgery. We can do both procedures in a timely fashion. And the nice thing is we're not increasing the risk by combining them and doing them both together.
Great.
Well, it's been a pleasure getting to know you. I hope I answered all your questions.
Yes, you did. I'm excited about having a whole new body again.
Great. You call me if you have any other questions.
I will.
We're here for you whenever you need us.
Thank you.
And I look forward to seeing you in surgery.
Okay. See you.
You take care. Okay.
Thanks.
Bye-bye. Hi.
Hi.
How you doing?
Good.
Excited?
Yes, I am.
What's this here?
Well, it's my Hawaiian bracelet that doesn't come off.
Okay.
So she just put gauze over it.
No problem.
Is that okay?
It's fine.
All right.
I'm going to need to have you stand up here in front of this wall like you did for the photographs. Okay, and what I'd like you to do is hold this at about there, and I'm going to take a blue pen, and I'm going to draw on you, like so, and this way I can sort of make the outline of a typical bathing suit for you. Let's take this down just about here. And this is what we have. Now, we're going to stay well inside of that. We have absolutely no problem, but we want to get rid of all of this, don't we?
Yeah.
Okay, let's start by making some landmarks. This is a midline mark. Unlike a lot of procedures, in plastic surgery, plastic surgeons draw on the bodies of the patients. It's important to plan this with the patient standing up, awake, and helping me. This way I can plan the incision so that it's well camouflaged by her bathing suit, and she's happy with the incision, and so am I. So all these stretch marks will be off. So your right breast is a little bit lower than your left, right?
Okay.
I will draw on her breasts and measure her breasts. We'll be measuring her breasts, planning the lift. So let's talk, while I'm getting this off, let's talk size a little bit. Would you like me to err on the side of making you a little larger or on the side of making you a little smaller? If I have two sizes in there, and they both look good, but one looks fuller than the other, obviously.
I go for the fuller.
Okay.
I'm excited, but I'm scared. I'm very scared. How's my body going to react to something, through the medication that I'm going to have to take, the anesthesia, the painkillers? Those are things that actually I have more anxiety about. Bruising, the healing process, the scarring. Yeah, there's some anxiety in this.
I'll see you when you get back, okay? Have a nice trip. We're doing a breast augmentation on this patient today in addition to a tummy tuck. So we're going to make her thinner and we're going to give her a fuller chest. Try to give her back the body she had before she had her children. We're going to be doing the breast enlargement or breast implant first. This is the real implant, the one she's going to have. It's brand new, never been used, 450cc Siltex gel implant. You see it has a textured surface. I'll be placing it under the muscle. Going very well. What we're doing now is starting the second part of the operation. I've completed the breast augmentation or breast enlargement, and we're now beginning the mastopexy, which is also a breast lift. This is looking great. tummy tuck or abdominoplasty. And this is a large one, a large incision, because she has a lot of extra skin. And we're raising her hips up as well as tightening her abdomen down. We're going to bring her hips up and her thighs up and get rid of that extra skin. Yeah, I have a 3/0 fibro. I'm going to close this, suture those down, and we'll be done.
There'll be no stitches on the outside, thus will eliminate the scarring that one traditionally sees with sutures that are used outside of the skin.
We're all done. Just waking up.
Good.
Anna will stay in our recovery area for about 1 hour, and she'll be at the overnight care facility for 1 day. We'll see her tomorrow in the office.
Hold on.
I would expect Anna to be completely recovered in 4 to 6 weeks.
Before, I was like always self-conscious. Ooh, does this bulge show? Or you know, what does this look like? Or in a bathing suit, forget it. I did not feel comfortable in a bathing suit at all.